World, we recently told you Eli Lilly released a new form of Zepbound for about half the price to patients without insurance. Now, the move is to meet the soaring demand, but also to ensure patients are getting the real deal versus the cheaper copycat versions. So joining me now is Dr. Sonal Haerter with Dignity Health Medical Group, and she's also board certified as an obesity medicine specialist. All right, Sonal, when we hear cheaper, sometimes we think, is this as good as the real deal? What are your thoughts on this new form?
So it's a real medication, and I call it cost effective. So it's actually the same medication that we use as for prescription of obesity treatments. It's only at the introductory dose, meaning it's at a dose that's a little bit on the lower side, but that's the dose we actually put most patients on when we start treating them for obesity. So it's a real medication. It is FDA approved. It's from the same company that makes the higher doses as well.
So you're basically just paying less for less.
Correct. Exactly. And this is a dose that also works for people who are trying to maintain weight loss. Not everybody needs the higher dose. So this dose is a great access to people who are starting on weight loss journey or maintaining weight loss.
Okay, so we talk about cost. That's another big, difference between the two. Talk more about the difference between the original versus this new form.
Okay, so the original comes in an auto pen injector. It's a little easy to actually use that, but this one comes in a vial and a syringe and a needle. So basically, people who do have a little needle aversion or just don't like injecting might have to get comfortable with this form. This is where they're actually saving money because these auto pen injectors are actually expensive. And that actually cost Eli Lilly a little bit of delay because it takes a lot of production to make these auto pen injectors. So those are the differences. And the difference is it's 2.5 and 5 milligrams, but the prescription medication can go all the way up to 15 milligrams. So those are basically the main kind of differences between these two medications.
Are there any downsides though?
So downside would be, this is televisit. So you're actually going on the website, you get assigned a doctor who's going to do a Zoom visit. I personally prefer patients coming in for a real visit. So I can do blood pressure and their weight circumference. So this is something, but the good thing about this website is this is managed by obesity doctors. So the criteria for obesity is going to be checked before anybody gets a prescription.
But if somebody wanted to do face-to-face, could they do that still?
So it's a face-to-face, but it's not in real time. So you can also face-to-face on Zoom. But you're not.
But I don't like that.
Correct, exactly.
I want to be in your office, weighed, measured, all of that.
I think
we still do
televisits, no, I don't think that's an option for this program yet.
That's interesting.
So, and the other downside is, Tram, it's still expensive. It's $100 for one vial of small dose. It's $3.99 for 4 vials for a month. Now, the good news is it's the same price that people are paying for copycat versions or compounded medications. So I would say people who are doing that now can go to an FDA version of these medications and monitored by obesity specialists online.
You hit my next question because we mentioned earlier about these copycat versions, the compounded versions. What do we need to be aware of to avoid them? Because it's not good, right?
So I think the number one question to ask is this FDA approved? Second is, who is managing the treatment? Is it an obesity or an endocrinologist or family medicine, internal medicine providers? That's very important. It's not just about giving a medication, but it's also giving recommendations on lifestyle, exercise, checking their vital signs, making sure their blood pressure and weight are supervised and checked on a regular basis. So FDA approval is important, even for compounded. In fact, compounded pharmacies, it's recommended not to use compounded products at this time. Doesn't matter what pharmacy. So I would say FDA approval.
So Zepbound is at the forefront. You think the others will follow suit? Ozempic that we hear about all the time, Mounjaro, all of them. What do you think?
Oh yeah, so Weight Watchers actually has a program where they do prescribe Wegovy, which is semaglutide for weight loss. Novo Nordisk, the company that makes semaglutide, actually has a program a little bit similar to this one on their website. And there are other companies like Pfizer who's thinking about coming up with weight loss medications. Eli Lilly and Novo Nordisk, who make these semaglutide Zepbound, are also looking into making oral forms. So I do think this creates a healthy competition. And we know 41% people in the U.S. have obesity-related complications. This is going to be a good thing for all of us, for people who need these medications.
It's the start of a wave,
Absolutely.
a cheaper wave.
Absolutely.
All right, Sonal.
Cost-effective way.
That's the
I like
nicer
that.
way to say it. Yes, exactly. Thank you so much. Always great to have you.
Thank you for
Sonal.
having